Symphasis pubic dysfunction is something that ladies get in pregnancy, and it's very common. And one of our experts at the clinic today, Sharon Smith, is going to tell us a little bit more about it. So tell me, what is it, symphasis pubic dysfunction, which we will now refer to as S.P.D.
So S.P.D is the misalignment and stiffness of the joints in the pelvis. So when you're pregnant, when a woman is pregnant, her ligaments become very lax and loose because of all the extra hormones in her body, and that then, because she's very busy still, when women are still very active when they're pregnant, your pelvis does change position and joints become very stiff, muscles can become very tight, and everything changes, and that can cause a lot of pain. So typically a woman would get pain around her pubic area, around the very bottom half of her tummy, a lot of low back pain, and she can still get pain actually in her pelvic floor as well. When quite often women go to the midwives or the doctors, and they diagnose them with this S.P.D and prescribe a brace for them, like a belt that ties quite tightly around them, but most of the time, quite often, the joints themselves are too stiff and malaligned that actually makes things worse.
Okay, so if somebody's had a brace but it's not getting any better, what you're saying is it's a good idea to come and see a physio.
Definitely.
Yeah.
Definitely.
And what would you do when they come to see you?
We would take down obviously all the history and do a good external examination. So just check their posture, check their position of the pelvis. Things can quite easily be straightened up and aligned again, very, very simply, very pain-free, completely safe for mum and baby. We can loosen any tight muscles, because obviously as bump grows, the tummy muscles just get tighter and tighter and get what's called trigger points. So muscles just clinging on too tight, and that's what causes pain as well. So we can release that. We can teach mum how to release it herself, so she doesn't have to, keep seeking help. We can teach her how to strengthen up the muscles that have got weak again as well. As her body's changing, different muscles are having to change with them. So we can teach mum how to do that as well.
Okay, so when should somebody generally come and see you? As soon as they get that sort of pain, just to check it out, or would it be advisable to go to their GP or midwife first?
Either or. If it's something significant, we could always send them straight back to the GP. So if they want, if it's quicker to see us, then by all means come in for an examination, because we know what we'll be looking for anyway. So a couple of days of tummy pain, back pain, leg pain, unsteadiness, feeling of your legs giving way, things like that, by all means come in and see us, and we'll be able to point you in the right direction.
And how long does it take to sort it out generally?
It completely depends on the stage of pregnancy, and again on the lady themselves. Some people we can fix just in a one straight off session. Other people do take time. Some people we fix, and then as baby gets bigger and the body changes again, it reoccurs again, so we have to go on to change it again.
Lovely. Well, thank you very much for your advice today. And if you want any more advice to do with pregnancy, please give us a call at the clinic and book an appointment with Sharon.